Hello, I'm Dr. Ruth Roberts, your pet's ally, and with me today is Dr. Will Falconer of the Vital Path. And Dr. Falconer and I have a very different perspective on how we've approached helping our patients. Dr. Falconer is a classically trained homeopath and has been practicing in that modality for many years, but certainly he went through conventional veterinary school, did traditional Chinese veterinary medicine training, and is just a vast wealth of knowledge. And you're getting, I don't know if you can see this or not, but you're getting lots of thumbs up and welcome from Amy Feltz. And Gail says she never misses your broadcast, and so welcome, and great to talk with you again.
Yeah, thanks, Ruth. I'm glad to be here. It's nice to be on another channel.
Yes, wonderful. And so you've got a workshop that you've started on earlier in this week, talking about how to raise healthy puppies, and indeed, that's an approach most veterinarians don't take. We just many of our colleagues just sort of vaccinate them and give them heartworm prevention and this and that and the other and call it a day as far as prevention medicine. But love to hear your sort of basic take on what wellness really is.
Well, it's interesting that the evolution of this came later than I suspected it would. You know, I got into holistic medicine back in the early 90s, and it was really interesting stuff. You know, feed them natural food and lots of things clear up, as you well know. So before I even trained in other modalities, I was just putting them on recipes from Dr. Pitcairn's book of, natural food for dogs and cats, and all sorts of good things happened, and slowly but surely evolved into TCM and putting needles in animals, and then finally homeopathy, which is where I really felt like I came home. But over the years, I was seeing these very damaged animals who'd already been through allopathic medicine and spent thousands of dollars trying to get these poor animals to stop itching or stop having inflamed, infected ears or any number of maladies. Those were the two commonest and still are. And it finally struck me, as they used to say in Missouri where I went to school, it gobsmacked me. And it was like, well, these are all man-made diseases. That they don't happen in the wolf. The close relative of the dog doesn't happen out there. They're not running around with inflamed ears, and they're not getting hypothyroid, and they're not, getting arthritic and all this stuff. And I went, well, it's all happening in that early raising of them, or rearing, as the English like to call it. So once I learned that, I went, I've got to slow down doing one sick animal at a time, because there's only one of me, and I've got to start teaching, because like you, I taught every client that came through the door, and still do if I have a client. But more and more, I've just gotten into teaching, saying, if we get to the real root of this, we can make decisions in that first year from birth, or even a little before if we're treating the breeding animals, all the way to that first year birthday. And if we make natural, sound choices that recognize Mother Nature's laws that have been there forever, we're going to have an animal that's above average in all ways. So that was a real awakening for me. So we've got all these choices in front of us. Every pet owner has a bunch of choices, and I'm just here to help them make smart ones. I see that being the linchpin of the trajectory for that adult animal for years and years. And the goal is have them really, really healthy and vital. That's why I call my practice Vital Animal. I want them just to glow,
Yes. And you're so right. I mean, we have the potential to do so much harm when they're just young puppies, with all of the stuff that we got taught to do. So amen to what you're saying. And that's the thing. I mean, golly, all of the stuff that our profession has been putting out as sort of the gospel truth of spaying and neutering at such a young age, and starting vaccinations at 6 weeks of age, and all of this stuff. We're just knocking their knees out from under them. And I know one of your sort of irritating things is you see these young dogs come in, they've been vaccinated, and then, you know, they've got this horrible itch that the owner just can't find an answer to. And it's coming from the vaccine, sadly. So, and I think you and I take a bit of a different approach there, but, you know, that's something I'd love to hear more about too. In fact, I had somebody ask in the Crock-Pot Chefs group, well, should she just take her puppy to a big dog park to expose it to parvovirus so he doesn't have to get the vaccine? I'd love to hear your comments on that.
Yeah, it turns out there's some really solid research on this, and I love it when it's there. So a colleague of ours out on the East Coast, I think she's in Connecticut, her name is Dr. Rosemary Manziano, and she's been a homeopath like me probably about as long as I have. And she started more than a decade ago, probably close to 15 years ago. She found out that there was a covey of infected with distemper raccoons living in kind of a marshy area not too far from her town. And she knew that raccoon distemper and dog distemper is really the same virus. So she asked her new puppy owners if they were interested in getting a natural immunity to distemper. And those who signed up, she gave them a very prescribed exposure that was very, very safe. You take the dog to this place where these raccoons hang out, you set them on the ground, let them sniff around for 5 minutes, period. You pick them up and you bring them home. You do that again the following week, 5 minutes, no more, back in the car, go back home. You do it a third week, and then on the fourth week, you pull some blood and measure a titer. She started all this, I think, when they were 10 or 12 weeks old. And lo and behold, that titer was just through the roof for immunity against distemper, which you and I know that kind of immunity is way better, way safer than picking up a fold of skin and squirting it in, you know, with 4 or 5 other viruses. So these dogs were like, boom, immune for the rest of their life from distemper. And then it evolved to the distemper kind of played out finally in this group of raccoons. So they likely got immune and they went on about their life in their pack. But she learned that recently vaccinated animals, who were often vaccinated for parvo and distemper, among other things, if they hung out in the dog park, they would be shedding some virus after they were vaccinated. And as you well know, parvo just is a ubiquitous virus anywhere dogs are. It's just in the environment. It hangs around. It may be in the stool of dogs who haven't got diarrhea. They just were beating it or holding it at bay, but they've got the virus coming through. So she said, well, now that these distempers, raccoons have played out, you can try the same thing at a moderately trafficked dog park. Bring your puppy 5 minutes a week on the ground, back home, 3 weeks in a row, and then titer. And now she found 2 titers coming out of these guys. Parvo was very high, and so was the distemper. And these pups were not sick a day in their life. They didn't miss a beat. They didn't miss a meal. None of this. So I described this in detail in video number 1 on this workshop called Won't Get Fooled Again. I think you've got a link up for it, and
yes,
people can go download it. It's all written up in a free report. They can download it and keep it for future reference. But that's been a protocol that you can take to the bank. A, it's free, and B, the immunity is stronger and more long-lasting than anything you'd get from a vaccination. And C, it's really safe. If you do just that brief 5-minute exposure a week for a few weeks, they're not going to get sick, and they're not going to have all the side effects that you and I see day in and day out of too itchy and allergic to this growing list of things that it seems crazy that they're allergic to.
It is insane, and it's like the margin for error is getting smaller and smaller with these guys too. But that's fascinating, and folks, I'm sorry we're having some internet slowdowns, but I'll be able to put a full recorded video up after we finish. But what Dr. Falconer was saying is that, you know, this veterinarian in the Northeast, and I apologize, I've already lost her name, has done studies.
Dr. Manziano.
Thank you. has done studies showing that puppies exposed to an area where raccoons with distemper virus were sort of loitering, if you will, or hanging out, for 5 minutes a week for 3 weeks developed protective distemper titers and actually kept those protective titers for all of their life. And then same thing with a moderately trafficked dog park for parvovirus. 5 minutes a week for 3 weeks and boom, they're titered, they have protective titers and they hung on to them. So, and many of you guys are saying that, you know people that have started recommending doing vaccines at 4 weeks and 6 weeks, just because the handler or the vet had a bad experience, and that's just absolutely ludicrous because we know the maternal antibodies don't drop down enough until at least 12 weeks of age for that puppy to even begin to think about responding to a vaccine. And somebody was saying that that she's got an itchy pup, even though she feeds a really good quality diet. And that's and so it may be that even though you're feeding the best quality food, allergies often aren't food allergies. There, may be some food sensitivities, but it's the immune system responding inappropriately to something that's in the environment. And so I mean, your series has just been fantastic, and certainly homeopathy came up with the idea of epigenetics before science got a hold of it. So if you've got damaged breeding stock, so to speak, you've had, particularly in the case of golden retrievers, they have such horrible issues with skin and cancer, and if you can't start with a healthy stock, there's no way that those puppies are, they're coming from behind the 8 ball. And I think that's a lot of what we see in our pets now that have such horrible issues with cancer. Is that something you found as well?
Yeah, I think what we can say is a reflection of what homeopathy is known for probably a couple hundred years now, which is that the parent's disease is passed on to the youngster. And the more generations that we go back, that animals have been vaccinated now, probably over-vaccinated for 30, close to 40 years, the more on edge the newborns are now. So it used to take them to get to maybe 6 or 8 or 10 years old before they started showing old dog diseases.
Yes.
Arthritis and maybe allergies and whatever, hypothyroidism. And now we're seeing those diseases push back in time. So generationally, we've got more generations of vaccinated animals. We've got more likelihood of even one vaccine causing what I call immune confusion. That's really that's the simple term I use for allergies. The immune system is seeing something that's normal, a flea or a bite of chicken or, a grass pollen, and going into this huge overreaction. And now they're furiously itchy and they're inflamed and their ears are on fire and all this. So it's an immune system problem, as you rightly point out. And it doesn't get better if you start vaccinating earlier.
No, it doesn't. And it really doesn't get better when you put them on the crappy hydrolyzed protein food and, throw drugs at it. Because then you're just, just stirring the pot and making things worse. So Michael's asking about leptospirosis vaccine. Docs, is Dr. Schultz correct in saying that it is not protecting? And for those of you that are not familiar with Ron Schultz, he's sort of the vaccine guru, for better or for worse. He did actually wake us up to the fact that maybe we don't need to vaccinate for everything every year back in 1990. 9, I guess it is. But so what Dr. Schultz says, and this is correct, if you choose to vaccinate your dog for lepto, and I think there's very few people that can actually make a case for it, you would have to wait for all the puppy vaccines to be done, and then 3 weeks later, first lepto vaccine, 3 weeks later, another lepto vaccine, 3 months later, a third lepto vaccine, and then in order to maintain some semblance of protection, you would need to vaccinate every 6 months. And I literally had, unbelievable, right? He said, this is why I don't recommend leptospirosis, because what you're doing to the immune system with this level of vaccination is just off the wall, and it's a bacterial disease, so it behaves in the immune system even more differently than the viral ones. I literally had a colleague sitting next to me at the dinner that looked at his associate and said, that's just too hard, we're not going to do it. And it's like, not, but he wasn't going to stop vaccinating for lepto either because he was making bucks on it, and just ludicrous. So, and have you? I mean, you're in an area where lepto actually is more of a concern, but have you seen that be a big issue with your patients?
I never have seen a case, Ruth, in 40 years of practice between Hawaii, where it was warm all the time, and Texas, more recently, the last close to 25 years, never seen a case. So I think it's much overblown, and I think from what I hear, not only is the vaccine ineffective, but it's one of the more likely to damage. Haven't you heard that as well? The sickness rate from being lepto-vaccinated is quite remarkable.
It is, and that's why, decades ago I quit vaccinating for it. So I came to holistic medicine a little bit more slowly than you did, and I'm like, what the hell is going on? Two out of 4 dogs are getting sick from this vaccine. This is ridiculous. So it really is ludicrous. I saw one dog in practice in 30 years that was literally drug up out of the swamp of South Carolina. And so, okay, but I mean, my golly, the number of vaccines given, and again, the serovars that are in the vaccine often are not protective for the ones that are out there. So it's one of those vaccines, it's just like, yeah, exactly. And Rashwan is saying that the vets push it because it's zoonotic, and that's a fear cell, basically. Yes, it is zoonotic, but the chances that most of our pets will ever have it are slim to none. Yeah, it's crazy stuff. So
the perspective that I like to share with people often is that if you look at the big pharma, the proportion of big pharma that's getting income from vaccines, it's huge compared to most of the rest of what they do. So the pipeline is continually filling with more and more vaccines. Oh, now we've got a vaccine for this, and now we've got a vaccine for that, and it's adding and adding and adding. So that isn't making every animal healthier.
Nope.
When you start out with a brand new life, it's not like they're born broken. That's a natural rearing principle from way back, probably from at least Juliet de Baracali Levy's day, where she was raising these amazing big breed dogs into their 20s. And they never got vaccinated. They had some herbs, in her learning from the gypsies, and they always ate some raw food, and sometimes she gave them some oats soaked in goat's milk and this and that. So there's examples. There's a whole history of, other than this little sliver of time where we've said we've got to give them all these drugs and we've got to give them all these vaccines and they're going to be fine. They're not being fine.
Exactly. And so this is the frustrating thing is, when parvo showed up in the 70s, I mean, it was an epidemic, and I treated a ton of parvo in practice early on. And in the 40s and 50s, distemper was a big issue. So how much of that was things kind of finally blew through? Because in the 40s and 50s, we hadn't quite gotten to the the bag of food at that point. So how would you kind of approach thinking through that a little bit?
Yeah, it's interesting. In pet medicine, we don't have nearly the natural selection that we do in the wild, right? We love each animal to death, and we're going to do whatever we can to keep them alive. Whereas if distemper blew through a wolf pack or a coyote pack, well, the weaklings would be weeded out, right? They wouldn't survive. Those who survived would pass on inherited resistance, and each successive offspring that were born to them would be more resistant. So we've done just the opposite. We've said we just honor and love every individual because they're a family member, and that's just the culture we live in. So was there immunity from all the vaccines, or did the population get immune? I think it's an open question. we sure don't. Interestingly, I've got another colleague who's done some research on parvo in particular in his practice in Indiana. And he's seen parvo affected animals who've been vaccinated and compared them to parvo unvaccinated animals, both of which got parvo, came into his hospital sick with parvo. And lo and behold, he kept track of who survived the best. And interestingly, it was the unvaccinated ones who survived far better than the vaccinated ones. So he was treating them both the same. He's a homeopath, so he was giving them the remedy appropriate to their condition and what they showed for their illness. He said all bets are off if they come to me already vaccinated.
And that makes sense. I mean, because unfortunately, it's really, really hard to get separate valencies of vaccines. And we know the distemper portion of the vaccine is immunosuppressive. And does that make sense to you that's why?
Well, so is the parvo.
Now, that part I hadn't heard before. That's fascinating.
Yeah.
Wow.
Yeah.
So you're seeing...
Big immune suppressor. In fact, I was blaming that. Only now I'm starting to hear a few people like you saying the distemper has that quality as well. So I came from the opposite pole and said, if you give parvo, whether it's a wild parvo or a vaccinal parvo, you're going to drop that immune system within days. And it's often, here's where we don't know the fine hairs of the thing, but you'll often see these puppies vaccinated by a breeder with a combination vaccine that start shedding coccidia, right?
Yes.
About, 5 or 10 days after a vaccine, something like that.
Right.
And now they're given Albon, they're given all these drugs to treat that. Well, why is that pattern repeating itself? It's because they've had a depression in their immune responsiveness, and the bug was probably there held in check. And you drop the immune system with that combo wombo vaccine, and now they're going to shed, and they're going to get sick, and they're going to get diarrhea, and now we're going to try to patch it up with the drugs.
Yeah, I hear you. You're exactly right. And that makes sense. We're getting a bunch of questions about heartworm prevention, and so my take has been to use minimum. If you're in the Southeast, you've got a little bit more time than other parts of the country. Even the American Heartworm Association is back to saying to give it every 6 to 8 weeks. Finally, they pulled that line of BS back out that you had to give it every 30 days. And I generally will recommend using just HeartGuard or one of its generics, just the plain stuff. But I know you've got some great success with not needing heartworm prevention, even down in Austin where it should be endemic.
Yeah, it is. And I'm going to hook you up with the ebook that I've got called Vital Animals Don't Get Heartworms. You should be able to offer that to your folks as well. And the
awesome.
bottom line is there's no reason your folks shouldn't be able to have access to that. The bottom line is that decades ago, I guess I was in the 90s in Hawaii, where it's endemic as well. It's year-round, warm enough for the mosquitoes to transmit if you're down at the lower levels. I just thought to myself, we're not reading in the news or, hearing on TV that the wolves are being decimated by heartworm or the coyotes are getting endangered because of heartworm. And I started researching that, and I said, well, why would that be? It could only be because they've got natural resistance. So lo and behold, even some of my professors from vet school were part of the studies that I cite in my ebook. They did necropsies on animals they found dead or on animals that were trapped. They blood test them, etc. The best work, the best pathology work, of course, the pathologist always has the final word, is the necropsy work. These animals died from other causes, and they, by the way, found a few worms in their heart. Well, when they looked at the data, these animals weren't less fit. They had normal weight. They died of other causes, not the heartworm. That was an incidental finding. And I went, we should be able to reconstruct that. And so into this drug-free heartworm protocol that I put together, go some of those principles of what would a wolf do to stave that off, or what prevents a coyote from dying in droves from mosquitoes, and they live outside.
Yes.
Talk about
I mean, they're
talk about
constantly
being in
exposed.
the path of the vector.
Yeah. Well, and it's weird.
So that's
Cats for a while were, literally dropping dead from heartworms, and then all of a sudden it just stopped. So, and I think what happened, and they're not the natural host, and so they've got ways to fight it off. But it's like there was this big clean out, so to speak, as you talked about earlier, and then all of a sudden I stopped seeing heartworm in kitties. But this, golly. So you're saying the same thing happens if they're healthy, then good. They won't. This is not an issue. They may be present, but they're not creating disease.
Yeah, and interestingly, I tell everybody who's following the protocol to test every year. And I get emails about every April saying negative for another year, negative for another year. So they're not even getting infested and not getting the disease. They're not getting infested at all.
That's awesome.
Now, I love that you bring that point up, though, because another interesting way to look at this is there's two things. There's infestation, like these coyotes had a few worms or had a handful of worms. And there's disease, which is where the heart fails and they die of having the parasite. Well, they're two very different things. And I remember, who's our colleague who died a few years back? He was down in Louisiana, another homeopath, can't think of his name, but he said, I know my dogs have got heartworm, but they do not have heartworm disease, and I'm not going to treat them for heartworm.
That makes sense.
They're healthy. They have zero symptoms, they're keeping ahead of it.
Yes.
So I think either outcome is possible. I'm thrilled when I get these emails every year saying, we follow your protocol, they're negative. It's been years and years I've been getting those, and I congratulate them and say, keep on, you're doing good stuff.
That's awesome. Well, and it's sort of like prostate cancer in men. I mean, finally, the doctors are saying, okay, for 74-year-old men and older, we're just going to stop doing PSAs because they're going to die with the disease. Something else is going to kill them, or they're going to die of natural causes. So that's starting to make more sense instead of, chasing our tails. Somebody commented that her vet made her vaccinate her 13-and-a-half-year-old dog and one of the other dogs with rabies to get their teeth clean, which is absolutely ludicrous. I'll try not to say a bad word. She needed, rotten teeth. What do you do? What should she do to help kind of clean things up?
Well, if they're really rotten, they need to come out. But you got to find a vet who's going to recognize that they don't need to be current on their shots at 13 and a half because they're not going to die of infectious disease.
No.
I'd love conventional vets to get that knowledge. Dr. Schultz speaks of that. He says they do not die of parvo at 12 years old.
No.
They do not die of distemper,
Well, and
they die of other causes.
Stuff. And it says it in the rabies compendium. If they have ever had a rabies vaccine, they're considered up to date. But unfortunately, this lady, she needed the teeth cleaned. The teeth had to come out, so she had to get the vaccine. So what, have you got some tips that she might do to help sort of stave off the effect of the rabies vaccine?
Well, I do, but I mean, it's way down here on the list of, if you can avoid it altogether.
Right.
And find a holistic vet like yourself or somebody else who understands that the immunity is existing. This wonderful concept from immunology that conventional vets seem to forget is duration of immunity lasts a long time, 5, 7, maybe 9 or more years. And rabies is one of the best immunizing vaccines we have at our beck and call.
Yeah.
So if you had, at 1 year of age, maybe your second rabies shot, that animal's likely immune for the rest of his life, law or no law.
Yes.
And the law is a whole nother thing that I tackle in another course that, I think is a ludicrous law. It has no bearing on immunology. It's not based on immunology. It's based on greed.
Yep.
And so that's a whole nother discussion. But yeah, it's really interesting. There's these two ends of the spectrum, right? You're born as a puppy, and what do you do to get and stay healthy? And then on the other end of life are these poor seniors. And for some reason, I've been getting a spate of emails lately saying, just like you did, I had my dog at 12 or 11 or 13 get a letter, or I wanted to bring him in for an exam or whatever. And they say, well, we can't even look at your dog unless he's up to date on his rabies. And like you say, up to date means, way back when he had rabies. And if you titered him today, he's probably still got a titer. But they went ahead and got the shot, and everything was downhill after that. The poor dog got paralyzed first in the larynx and later in the rear end, or came down with autoimmune disease or any number of things. It was just from there is where they could track the downward spiral.
Yeah.
And I just feel so bad for those animals. It was so unnecessary to get that shot. And so wrong-headed to call it out as, oh, he's due. You won't be a good pet parent if you don't do this, because he's due.
It is. It's horrible. And unfortunately, what I'm finding is that so many people that live in, small towns, their vets are just bullies. And so they just, they literally refuse. I mean, it's ludicrous, but for animals that have been hit by a car, have had some sort of trauma, and the vet's like, well, we got to give it a rabies vaccine because he's overdue. And I mean, it says on every box of vaccine, do not give to sick animals, and yet our colleagues do it. So I feel for you all out there, because your vets are beating up on you and refusing to give you services. And when you're in a one vet town, and your next, and your dog's bleeding, and the next town is, 100 miles away, it gets really tough.
Yeah.
But you're, Doc, you're absolutely right about the rabies law. It is ludicrous, and it is based on greed. And I think the last rabies compendium did help. Titers. So I'll dig up the link for the rabies compendium, which will give you guys a little bit of ammunition, so to speak, when you go talk to your vet, because it spells it out pretty clearly. And they say in there that a titer is an acceptable estimation of protection. So there is a lot, but I think if you throw that down in front of your vet, you may piss them off. But on the other hand, too, you may educate them and get them to back off of this a little bit. So, and Sherry's asking, how do you get around the law for rabies? And
sometimes it's as simple as saying no.
Yep.
It really is. They're not police officers. Veterinarians don't have a badge hidden under their shirt.
Nope.
And so that whole, I'm here to enforce the law kind of stuff is a bogus call. You
Yep.
can say very confidently, I know my animal's immune to rabies. I've been a good citizen because we did it way back when. I'm happy to get a titer and measure that and prove it if somebody wants a proof of it. But at 16 or at 12 or whatever he is, and in his sick state, I'm here to get treatment, and I will not allow him to get vaccinated. So what I aim in all my teaching, Ruth, is more than anything, I want people to gain confidence that they can call the shots on these things. The more you learn, the more your confidence grows, and the more you can say, no, thank you. I've got a classic interview in the third video in this Won't Get Fooled Again series. Sarah, a longtime client of mine, way back to I guess when I moved to Austin in the mid-90s or so, now has her third generation of wildly healthy Akitas, usually has 3 or 4 of them. And she goes in every single year and gets them heartworm tested. They're negative year after year. And they've learned to stop asking Sarah, you're out of date on the rabies.
Yes.
Because she said, no, I'm not going to do that again. They're
Yep.
done. They've had their earlier shots and they're finished. And so they respect her. They know that she knows that immunity is long lasting, and she's explained it to them. And I've got a number of students now who have gotten what they want at a vet visit. And that is my golden goal for every student I educate, is to say, you call out what you want. And if it's just an exam, lovely. If it's an exam and some blood work, no harm done. But when it comes time to, we think we should give this, or you are overdue for that, that's where you can put the brakes on. And at the least, if you're not confident in the spot to say no, you can say, let me get back to you on that.
Exactly.
I'm going to go home and research it a little more, and I'll let you know if I want to do that.
Yes.
That's a very powerful stand in and of itself.
It is. And it scares the bejeebers, or it irritates most of our colleagues. But for people that are good vets, I mean, and this is the trouble, is that most veterinarians are good-hearted, but they are so overwhelmed in practice and so busy that they never take the time to look and see maybe there's a different way. But when you say, let's just wait on that, and then you offer information, and sadly, most veterinarians need a little education on their profession as far as vaccines and things, then that gives you a little bit more power, and you've protected your dog, more importantly. And same thing with cats. This whole business of vaccinating every year for cats is ludicrous, and that's how we discovered that, lo and behold, Dr. Schultz's first paper came out in, I think, 1993 or 4.
Two.
Yeah, with the duration of immunity studies. And the fibrosarcomas in cats are what forced us to read the study and realize that, ooh, this is, okay, so I guess we don't, now what do we do? Because we've been saying, okay, you have to do this every year, but we're giving a certain subset of cats cancer by vaccinating them every year. So just ludicrous stuff. So, and Sherry's saying, you know, they're out there fining people like $2,500 for not getting rabies. And so, folks, you know, what you've got to do is get in as informed as possible. Dr. Falconer's got some awesome information. I've put the link in once for the course, and I'll put it back in that's going on. But that's just one of the many things that he does. So we'll get you some more information on that. And Will, you've got a natural rearing course coming up that's available, and would you like to talk a little bit about that and let folks know what they could learn in that course?
Yeah, sure. We're really going deep on that. So the workshop is a great way to get a taste of kind of principles and some real practical things you can put to work right away. But I believe it's tomorrow. Yeah, tomorrow the Natural Rearing Roadmap course is going to launch. And we've been scurrying, getting it all ready for everybody. And in it, what we do is basically lay out a path from birth to 1 year of age, or even pre-birth when we talk about what might be done with the breeder's side. You know, we've got natural rearing breeders now who have generations of unvaccinated animals who are healthy as all get out. They shine, reflect the sunlight back at you. Starting with, you know, at whatever age you get your pup, and even talking to the breeder when that pup is born, having some things in place with these natural rearing principles to set the trajectory for what happens in that first year. Are we going to vaccinate at all? If we are, how are we going to do it? Are we going to neuter? If we are, when are we going to do it? And how are we going to do it? If the pup gets to wean itself from mom, or if the breeder steps in and says, no, it's time, we're asking questions and we're giving guidelines and saying you can really paint your own course, but the goal is that you learn enough to set a course on all these decisions that you make in that first year of life, such that from 1 year on, the trajectory is set, and that animal is now way above average in all the health markers. The teeth are beautiful, the eyes are clear of discharge, the coat is soft and luxurious and shines, the heartworm tests are coming up negative already, there's no worms in the stool, you know, on and on. And that, up to that first year mark, if you keep doing those things, well, that animal's going to live longer than the average dog. That animal's not going to fall prey to the chronic diseases that are so common, like allergies and hypothyroidism and arthritis and all that. And that's really it's a golden opportunity to just say, I'm going to study with a group. We've got a very supportive community on Facebook where students in the group get together and ask questions, and my coaches and I are in there to answer. I give them a weekly live Q&A call that's just for them, and they go over a couple of modules of the course, and we discuss it, and we've got open forum on a Zoom call to answer all those questions. And all of that put together just raises what you might call a bulletproof animal. They're just naturally resistant to disease. They're wildly healthy, and they're vital in all aspects. Their behavior is good. Their brains aren't on fire from all these vaccines. Their coats aren't itching and falling out. Their ears aren't getting inflamed. They are what I often call vital animal ambassadors. So what that means is they are drawing people to them in the dog park. They're like magnetic. They're how did you get this animal to look so amazing? And then the information starts transmitting. So you say, well, I didn't do the normal rounds of vaccines at 6 and 8 and 10 and 12 and whatever weeks they're doing around me. I chose a different path. And instead of putting the kibble in the bowl every day, I learned how to raw feed, or, I did something natural. I cooked at home, whatever. And instead of using the heartworm preventatives that I know are pesticides, I chose another path there, and I don't have to deal with fleas. They jump off the dog. If my dog gets next to a flea, the flea doesn't even want to live there. It's just too healthy, so they're jumping off instead of jumping on. And that, I just love the ripples that happen. When students are successful like that, it's just a natural that they affect other people. And I've got some amazing students. One of them is I'm going to have a story about her on the website, vitalanimal.com. Stephanie is a vet tech who took the Natural Rearing Roadmap course a couple years ago. And she said, all of that stuff you were teaching just made so much sense that to continue in my conventional vet tech practice with the vets I was working with, it just was no longer a fit.
Yeah.
And it was an eye-opener to say how amazing that resistance can be built up without lots of drugs and without lots of shots. They can be encouraged to be naturally disease resistant and parasite resistant and all that. So she had to kind of leave the practice after a while because it was weighing on her conscience. And she's now got her radar out to say, where's a holistic vet who might want to have a great vet tech on board,
Yeah, I hear
you. So that's it in a nutshell.
It's and that's awesome. So, folks, I'll put the link in again. Go sign up for Dr. Falconer's workshop. There'll be some information shortly about how you can sign up for the natural rearing course as well. Dr. Falconer gave me access to it a year or so ago, and it really is one of the most comprehensive ways to look at and think about how can we raise these guys so that they're healthy. And he gives you the ins and outs of all the stuff that you're going to be, all of the choices that you're going to have to make. And that's amazing. So go check that out. Doc, anything else you'd like to let folks know right now? We've had a wonderful live, and I'm not sure if you can see all of these comments coming up, but just tons and tons of comments. I mean, I think we're pushing everybody's buttons, which is great. I mean, you guys are furious because you're getting bullied into doing stuff. So knowledge is power.
Yeah, I think the ending place for me is always just learn as much as you can. Listen to what Dr. Ruth is putting out. If you want to come and take a course with us, we'd love to have you. The bottom line is the smarter you get, the wiser your decision-making process is. You're not making decisions on a basis of fear. You're making decisions for your animal from a basis of knowledge. That is a powerful difference, hugely, hugely powerful. And that's my goal. I couldn't, in good conscience, just play small on this and treat one sick animal at a time. I had to get out and educate. So that's where I put all my eggs in the same basket of helping pet owners learn. When you learn, then you never go back and do the things that you look back on and say, why did I do that? I didn't know any better. When you know better, then it changes the whole equation.
Amen.
And what you learn now informs what you do with the next several generations of dogs that you're going to come into contact with, or cats, or whoever you're raising. So it's timeless stuff. It's nothing. It's nothing. Cooked up by some holistic minds in the garage. It's timeless principles. It's following Mother Nature's principles, and they've been around since the planet's been around.
Amen. Well, Dr. Falconer, thank you so much. This has been a blast, and I think everybody's had a grand time. So I'm going to hit the finish button here, and folks, sorry my internet here is not fantastic. I will upload the complete video in the comments section so you can go back and listen to it as well. Again, many thanks, and remember, until next week, your pet's best health starts in the bowl. Take good care.